My name is David the Fish, and we are in Chippewa Falls, Wisconsin, the home of the purest water in the United States and the original home of the supercomputer industry. Chippewa Falls, Wisconsin is in Chippewa County, and we're in the northwestern part of the state of Wisconsin. And the name of this hospital is Good Luck. It's actually St. Joseph's Hospital in Chippewa Falls. When you look at health care and how was it that I got into this, originally I actually thought I wanted to be a doctor. And then I had learned, holy Toledo, blood is involved in this, and I don't like blood, and I'm not very good with my hands. So subsequently I thought, hey, I could still be involved and somewhat aligned with health care, and that would be on the management side. I wanted to be part of a multi-hospital system too. I didn't want to just be stuck out in the woods totally by yourself. And this particular hospital is owned by the Hospital Sisters of the Third Order of St. Francis, and they have a number of other hospitals, 4 other hospitals in Wisconsin, and they have 8 other hospitals they have 8 other hospitals down in Illinois, and their headquarters is in Springfield, so they're only in a 2-state area. They're a regional healthcare system by design, by intent. They started out serving people in rural communities intentionally, and the places where they have hospitals and have a presence, they've been in all those communities for over 100 years. In fact, this next year we'll celebrate our 125th year. The challenges, when you look at today's healthcare system, the challenges are incredible. That is the economics. Everybody talks about everything costs way too much, number one. And number two, the people that provide services often say, well, the fundamental reimbursement system that we have, it is not working. Our biggest purchaser obviously is government. That's through the Medicare and Medicaid programs. Neither of those programs pay what it costs to provide care to individuals. And when that happens, then these areas where you have the gaps, those costs get shifted to other people. And the projection is actually, if everybody just paid what it costs, number one, we'd probably be able to reduce health care benefit costs to employers by about 25 to 30%, which would be a pretty big, significant economic number. And especially if you're an employer and you keep pulling the hair right out of your head saying, that's the one thing I can't control is my health care costs. It's the paradox of the country. That is, success is always predicated, at least the perception of success is always predicated upon size. And when you start having people, when you start talking about things, they start talking about numbers that are equatable to size. For example, how many stories there are in the tallest building in the country, or however many stories that skyscraper is, or however fast you run the 100-yard dash. It's always put in some kind of a quantifiable relationship. And then the paradox is when you're dealing with large organizations, and people always think, oh, large organizations are the answer. And the reality is, where does the economic strength of this nation come from? And its growth and development, it's small companies, creation of small companies. And often when you're in economic difficulties, such as this nation is right now at this point, what is the entity that will lead us, I think, out of this? It'll be a combination. It'll be a number of small companies that are very creative. There's more innovation in times of economic downturn than ever, one ever would really imagine. But the second thing is, the one that always gets a lot of the credit are the big companies. But the action is in the small companies, the smaller rural areas. There's a lot of action. When you look at the size of organizations, big companies suddenly always try to tell you how small and loving they are. And small companies always think, or smaller places always think, to be successful, you got to be the biggest gorilla on the block. So both of them are sort of misnomers. The other challenge is obviously physicians having an excellent medical staff, being able to recruit absolutely excellent physicians, and then being able to retain them. And it's becoming more difficult, given the profile of medical schools today are changing. the work ethic of today's physician, or at least tomorrow's physician, is far different from the work ethic that existed when I first started in healthcare. I mean, doctors back in the 60s, I mean, they'd work day and night, 7 days a week, and if there had been an eighth, they'd have been there working too. Very little time with their families. And people of today are saying, hey, you know, we have to have a balanced quality of life, etc. Well, in recruiting today's doctor then, who doesn't necessarily always want to work full-time and doesn't want to be in some place day and night and away from his or her family day and night, you have to be sure you have an excellent, loving environment in which they can practice. Not just in terms of the people and the resources you bring, but they have the technical resources too. Because there's so many choices wherever one can go. And to be efficient and effective, part of what you would want, being a graduate of the medical school, would be the technology to support the skills and abilities you have so you can best care for the patients, the people that come to you that you have the privilege to serve. So for example, like at our sister hospital, there's a brand new intraoperative MRI that's in our surgical suite. There's only 6 of these in the country, and there aren't any in a facility of that size in the nation. So it just shows you we have to have the ongoing commitment to technology. We have to have the ongoing commitment in terms of our staffs and the training and development of people, so that the work environment and the resources, the human resources we have, are very supportive of the professional resources coming through medical school and other facilities. So that's a huge challenge. Another big program really is through our sister hospital, we're really learning even better operational discipline. That is sharing with our people, our colleagues, the realities that confront us, whether they're economic realities or service or program realities, and we're in a very timely fashion educating through institutes, our workforce on critical issues, focusing on certain things, and then talking about our performance, etc., so that people can equally engage with us in shaping the reality and the ability of the organization to be able to respond, you know, to the pressures and realities that are an everyday part of this industry. So the bottom line, the last thing is, hey, just all you got to do is be all you can be. That's it.